today we're going to talk about gallbladder disease. The gallbladder itself is a small sac that contains bile, and what bile does is it helps to digest fatty foods. The gallbladder is connected to the liver by a tube, and then that's connected to the small intestine. So when you eat something fatty, the bile that has been stored in the gallbladder gets released, and that's then goes into the small intestines to help digest the fatty foods. And so patients with gallbladder disease tend to have pain when they eat fatty food because if they have issues with the gallbladder, when the gallbladder tries to contract to get bile out to help digest fatty foods, the contractions cause some pain. So there are different types of issues you can have with your gallbladder. The first thing is that your gallbladder might just have some stones in it, in which case, whenever you eat fatty food and it contracts, you have some pain. That's called biliary colic. The treatment for that typically is to remove the gallbladder surgically. There's really no way to just break down the stones in the gallbladder. There are different things that have been tried in the past, but the current standard of care is to remove your gallbladder. And this is not an emergency surgery. This is just something that you optimize and you remove. In the meantime, till you have your gallbladder removed, you should stay on low fat foods because if you're not taking a lot of fat, then you're not stimulating your gallbladder as much, and so you have less pain. The other thing that can happen is the gallbladder can get infected, and in which case you can have a situation where you're pretty sick, and then surgery becomes something that should be done sooner rather than later. That typically is something that you do surgery for in a matter of day to days. Sometimes the stone can leave the gallbladder and it can block the duct that carries bile to the small bowel, and that can make a backup of everything, of all the bile, including into the liver. And that becomes more of an emergent situation, especially if it becomes infected. And typically, you do want a procedure called ERCP first to clear the duct, and then you take the gallbladder out. Sometimes it can block a duct lower down, which connects to the pancreas too. And in that situation, you can have inflammation of your pancreas. Again, this is a situation where you want to clear the duct and then remove the gallbladder once you can. So if you're having pain at the right side of your abdomen, in the right upper part of your abdomen, every time you eat something that is fatty, then you should talk to your doctor about potentially this might be gallbladder issues that can be taken care of by same day or maybe just an overnight surgery. So you want to talk to your doctor about that.